that, I'm going to introduce Bob, who's going to talk about one of my favorite people in the world, this wonderful man who we released, who after 41 years has not a bitter bone in his body. I just really admire him. So Bob, tell him.
Okay. In 2005, I retired from my law practice, which was a civil practice. I didn't do criminal cases, but I had one, what I consider a civil case, which was trying to help this inmate whose name was Delbert Wakinakona. And Delbert, I had been working to try and get him out of prison for a variety of reasons for 15 years, and had asked the paroling authority to reduce his minimum sentence, which they refused to do. I'd asked Governor Cayetano to commute his sentence, which Governor Cayetano refused to do. I asked Linda Lingle to do the same thing on Delbert's behalf, and she too refused. So in May of 2010, Delbert was serving a very long sentence, and his background is very, very complicated and interesting. He's a wonderful person. When he was a young man at age 26, Hawaiian, of course, grew up on the streets, literally, in a terrible household situation. He was beaten all the time. He was abandoned by one of his parents when he was very young. Everything you can imagine that would go wrong had gone wrong for him. But he was with a cousin who, they went into a store to rob it. His cousin ended up killing somebody in the course of the robbery. And back in those days, it was 1971, we had a law that said if you are present and participating in any felony, including robbery, and somebody is killed or dies, you are guilty as if you killed them. It doesn't make any difference that you were just a bystander or an accomplice. And Delbert was sentenced to life without the possibility of parole at age 26. We eventually got that changed to life with the possibility of parole. They gave the murderer, the paroling board gave the murderer, the man who actually committed the murder, a 25-year minimum sentence. They gave Delbert 30 years. Delbert was viewed as a troublemaker in the prison, so in 1983, when he was still a young man, they shipped him off. He was one of, you know of all of our prisoners going to the mainland now. Delbert was actually the first. He was sent out way back in 1983 under an agreement with California to Folsom Prison. And he spent 20 years at Folsom under the worst conditions you can imagine. And he was a model inmate. But still, the parole board would not reduce his minimum sentence. The governors would not commute him. He did everything he could to show that he was a good citizen, but still nothing would change their minds. And he remained at Folsom and eventually came back here for a short time, and then they shipped him off to Arizona. So in May of this, in 2010, I was preparing another application to the new governor, at that time Governor Abercrombie, thinking, okay, we got a new governor, the governor has the power to commute a sentence. Maybe we can convince this governor to let Delbert out, who at that time he'd been in prison for 41 years. And he was, I think, 67 or 68 years old at that point. So I was working on that when I got a call from Delbert, and he said, you know, and I said, what's up? And he said, well, I just got back from Casa Grande Regional Medical Center. I was in the hospital. And I said, oh, what was wrong? And he said, well, they had to drain this fluid out of me. My legs are swelling up. And I knew Delbert had suffered for a long time with hepatitis C, and it was, you know, basically he received no treatment for this in prison, none. They tried treatment way back in the 90s, but it didn't work, and that was the last help that he got on the problem. And I said, well, what do the doctors tell you? And he said, well, they tell me my liver's shutting down. And of course, you can't live without your liver. So I said, well, I don't know what I can do. Let me see. And of course, one of the first persons I talked to was Kat, and you know, talked to some other people, and we all came up with the idea of compassionate release. So I did some research, only to find that there is no statute, no law in Hawaii that provides for compassionate release. There is a rule of the parole board which says that if death is imminent, they can release an inmate, or if they're unable to provide the care that the inmate needs. So the only two circumstances under which they can release somebody. And then I looked over at the Department of Public Safety, And they had a policy, but the policy didn't really spell out how anything worked, or who had responsibility for what. And it said that if somebody is terminal and has less than a year to live, they can be recommended for compassionate release. So, but there was no procedures at all. So I didn't know what to do. So I just drafted a request for compassionate release. I took one over to the parole board and I said, here, under your rules, I'm making a claim. And I took another over to public safety and I said the same thing. And I said, here it is. Now, will somebody please tell me how this all works? And of course, nobody did. Anytime I tried to do something, they would say, oh, you can't do that. And I would say, well, why can't I? And they'd say, well, we just don't do it that way. There's no rule, there's no regulation, there's nothing. And it was incredible. So I didn't know what to do. But I figured somewhere I got to get a hearing, whether it's one of these agencies or the court. So I went out and I needed to prove that Delbert was, really sick. And so I hired an expert, and I paid him. And he is one of the world's leading authorities on compassionate, on hepatitis C. And he looked at the medical records and he wrote a very good letter for me saying, this man does not have long to live. Gave that to the Department of Public Safety, and they basically said, well, that's interesting. Here is this. I mean, this guy was. I mean, his name is Dr. Robert Gish. He is probably one of the world's authority, maybe the world's authority on hepatitis C. And it was only by chance that I was able to get his attention on this, but he was really gracious to help. So I send the letter over to the Department of Public Safety, and what do they tell me? Oh, our doctors don't think it's that bad a situation, so we're not going to recommend that he be released. So at that point, I just didn't know what to do. I went back, and every day as it went on, I kept waking up thinking, well, is today the day that I'm going to lose this whole thing, because Delbert dies in prison in Arizona. And it was an incredibly frustrating situation. Finally, somebody over in Arizona decided they'd bring Delbert back to Hawaii and let a doctor over here take a look at him. And so he called me and said, Bob, it's amazing, but they're sending me back to Honolulu. So they did. They sent him back, and the doctor takes a look at him and over here, and that doctor says, oh my God, of course, this guy should be released. He's in the, and he has end-stage liver disease. So he writes a letter to the people in the department, to the director, saying, in my professional judgment, this person should be released. It goes up through the chain of command in public safety. Everybody agrees. The director agrees. It goes over to the parole board. And what happens? The administrator of the parole board takes this recommendation from public safety over to the chairman of the parole board and says, this guy doesn't meet our criteria. The chairman of the parole board says, okay, then just, that's the end of it. Send it back. So they send it back. The full parole board never even saw it. Delbert did not get a hearing. No, the only person who saw it was the chairman and the administrator. And they just dumped it back because they said, well, he doesn't meet our criteria because we don't believe death is imminent. And we can care for this.
I want to jump in here. And at this point, the community decided we were going to do a vigil outside the parole board for Delbert.
Because there was nothing else we could do.
So I have a big email list. I put it on my email list. Somebody picked it up and tweeted it out. And apparently one of the members of the parole board got that tweet and went in and talked to the chair and said, what the heck is going on? If this man dies, this is on all our consciences.
Yes, exactly.
And that really motivated, because the whole parole board, we weren't asking for Delbert to be released, we were asking it for a hearing.
Yeah, that's all.
And they didn't even want to give a hearing to this man. So it really shows the power of the community, and later on I'm going to talk about how you can help us pass this bill.
So, we were literally ready just to send out this press release calling for a candlelight vigil to support Delbert and get the parole board to give us a hearing. When they decided that they would give us the hearing, they actually gave it on 24 hours notice. We went in. A doctor came on the phone. He was testified by phone, the Halava doctor, And he said, I believe that this man could be dead in as short as a week. He might live as long as 30 days, but clearly he meets the criteria and should be released. They released him, much to my amazement, and through, well, I should also point out that, you know, I was there at the hearing, but because I had retired, my license was inactive, and so I don't have any status to do this, but fortunately I'm on the board of the Native Hawaiian Legal Corporation, and they're a great organization. And I went to them, our executive director is Moses Haya, and Alan Murakami, and I said, look guys, I don't have a license. This is a Hawaiian guy. He needs help, and just like that they jumped in and said, hey, we'll do whatever we need to do. So they actually did the hearing, and I sort of tagged along, and they let me in, you know, just to be there. And so on October 28th of 2011 at 4:44 p.m. in the afternoon, my wife and I went out to Halava prison and walked in the front door, and there was Albert in his wheelchair with a garbage bag full of his belongings, and we put him in the car and we took him to freedom after 41 years. So it was that experience. It took 6 months with no rules, no regulations, no law, completely arbitrary process, people, frankly jerking you around whenever they felt like it. And I just said, well, we got to have a law. Nobody should ever have to go through this process again. And so that is the genesis of this bill that Kat and I have been working on.
And one of the interesting things about Delbert is that Delbert actually brought a case before the Supreme Court about being transferred out of Hawaii. And he lost that case, but it's a landmark case at the Supreme Court, and there's a lot of feeling in the community that he was being punished for bringing that suit because it kind of shined the light on what Hawaii was doing. And you know, sometimes in Hawaii, they kind of like that phrase, what happens in Hawaii stays in Hawaii. And of course I really like to broadcast what's happening because I think it's really important. This is about compassion for our citizens. So this year, a bill that's coming out has all the research in it, and probably the premier research was something that was published in the Annals of Internal Medicine. And the lead author was Dr. Bree Williams. Well, Bob actually went to California and met with Dr. Williams. And she is willing to come to Hawaii to testify, to meet with people, because she knows how important it is that we take care of our citizens no matter what. So this year, the bill has no number yet, but it's currently being drafted. It will be introduced by Senator Willis Sparrow, and he's the chair of Public Safety. And how you can help is by providing testimony. So I have a sign-up sheet where you can write your name and email or phone number, and we can let you know when hearings are. Even 2 sentences that say, I think people need compassion, I think the department should, I think that compassionate release should be in statute, would be fine. You don't have to write a tome. My testimony is always voluminous with, lots of footnotes. But generally when I testify, I pick 3 to 5 points that I want to make, and I talk to the legislators. So, any kind of support that we can get from the community is really important, because this is really, really about people. And I just want to read you a quote from the Dalai Lama. He said, all major religious traditions carry basically the same message. That is love, compassion, and forgiveness. The important thing is that they should be part of our daily lives. So that's really what we're asking the Friends meeting to do, to support people who have no voice. Their voices have been silenced by incarceration. And if it wasn't for Bob, Delbert would still be inside and would probably have died inside. So when this is a real life case, and you know, I know real life cases of people who have died alone when their families were, in some cases, right up the road from the prison, saying, please send our loved ones home so that we can surround that person with love their last days, and they've been denied. So it's really important for the community to stand up and say, we are a community. We're Hawaii. We care for and about each other. And it would be really powerful for the Friends meeting to send in testimony as, you know, your own name and as part of the Friends group.
Could you give us some statistics about cases which you were considering were good cases for compassionate release, and what happened to them eventually, and how many actually made it? And the other question I have is, I guess it would be good for Bob if he could get his license renewed.
No problem, is there?
Well, I like to
You're too young.
Thank you.
You're too young to be retired.
I like what I'm doing now, though.
Yeah, and he's great. Well, I like to do a lot of research, so when I go before the legislature, I like to show them, you know, what's actually been happening. So between 2009 and 2011, there were 37 requests for compassionate release. We have about 6,000 incarcerated people. So we're not talking about huge numbers of people. We're talking about a small portion of people. So 37 people wanted compassionate release. 22 were recommended by the Department of Public Safety to be granted a compassionate release, but they only make a recommendation to the parole board, and the parole board in 3 years only granted 14 compassionate releases. So we're talking about 3 or 4 people a year. I mean, we're not talking about huge numbers of people. If it was even 20 people a year, I would be very surprised. So we're not talking about a compromise of public safety. People are not released into the community, they're released on parole. They're supervised by the paroling authority. So it's not like we're just letting people out into the community to run free. Most of these people can't even run. So we're talking about people who would be released on parole, and there's a whole vetting process in public safety before it even gets to the parole board to determine, is this person a risk to the community? Is, you know, what is the likelihood this person will commit another crime? And what's interesting about elderly and chronically ill people is their recidivism rate is minimal, like 2 or 3%. So people generally what they call age out of crime. And the majority of our system is really people who are, you know, 20 to maybe 39. But, you know, after that, the recidivism rate is extremely low. And we're really talking about human beings and humanity. And how do we as a community feel about people dying alone in prison when their families want them to be home so they could care for them?
But what about who's going to take care of them? Because since they've been in prison, they don't have medical insurance. And everybody knows how difficult that is, and especially if you have a condition that's killing you. Who's going to be paying for that? I mean, if they get out.
In many cases, it's the family. In some cases, it's Medicare or Medicaid. And many of the chronically ill and elderly are veterans. And the Veterans Administration has been willing. I'm working on a case right now, a person who is, I think he's 65, he's a veteran, He's suffering from PTSD. His attorney retired and is in California, and he's been calling me. I knew him before he retired. And I've been trying to, this man's family is in Rhode Island. They're willing to take him. The Veterans Administration is willing to take him. And I keep running into all these hiccups at the Department of Public Safety saying, well, you know, he's not really that sick, and, you know, and he has cirrhosis of the liver. He's really not in good shape. He needs a lot of medical care. And yet it's really bizarre that they're holding this up. And he's not the only one. So for us, it's really about how do we care for those people who can't really care for themselves when their families are willing to step up, when there are other entities that are willing to step up. Why can't they be released?
It's actually, it will save money for the state, because right now the state, when any inmate needs medical care, pays on a fee-for-service basis through contracts. So 100% of the fees, whatever they have negotiated with the medical institution, is paid for out of taxpayer money. Whereas, like in Delbert's case, as soon as we got him out, we got him onto Medicaid. And at least Medicaid is partially paid for by the state, but you get federal help with it. So it actually saves the state money to release these inmates. And frankly, I think they get better care on the outside.
And it was kind of funny because when we brought that up at the hearings, some of the people in the medical division at public safety said, oh, it's not about money. We care about the patients. And we said, then why can't they be at home with their families? And why can't they get medical care in the community when we have entities that are willing to step up? Why can't they? And it was like they would constantly turn that conversation. Oh no, our main concern is the patient. It's not about money. And yet we all know the price of health care is humongous for any business, and especially for a state agency that is entrusted with the custody and care of people. So it's not about money, it is about the patients, but a really good byproduct is that they could probably get better care and the taxpayers could be less burdened.
Yeah, because they really have a choice of doctors, you know, with Medicare, and Delbert has really had some very fine doctors, and he's had 3 surgeries.
Is Delbert still alive?
Yeah, I forgot to mention that. Delbert, who was supposed to die in no more than 30 days.
Yeah, those 30 days are passed.
I don't know the medical causes of this. My own impression is that being free makes a huge difference. Having a loving family around you, it makes a huge difference. Having real good doctors and hospitals around you makes a difference. Delbert was supposed to die by the end of November of 2011, and I just got an email from him yesterday. So.
And he actually, his last surgery was brain surgery.
Yeah, he had brain surgery.
He's got a host of healthcare problems.
But he, you know, here's a wonderful scene, if you will. I mean, Delbert, you know, was sent to prison for, you know, his participation in a robbery where someone died. It was called felony murder, and he was convicted of that. He also, as Kat said, took this case all the way to the United States Supreme Court. Delbert also escaped several times. And one time, interestingly enough, he called, I don't know if you remember Bambi Weil. She was a reporter then, and he said, "Look, this is Delbert. I'm the one you've been reading about in the paper, the escaped murderer. You know, we just had a young man commit suicide in prison here because we have no programs. And I'll make a deal with the governor. If you get some programs going out here at OCCC, I'll turn myself in." Well, then the governor had Lieutenant Governor Doy responded, "We're not negotiating with this guy." The next day, Delbert would call back and say, "Look, we need programs, we need help out here." And this went on until they caught Delbert. I mean, that's the kind of guy he is. He's an amazing human being, and here was the wonderful scene when I heard that they had this there's a bill coming up in the legislature too on Pu'uhonua, which is the city of refuge, kind of looking for how this can be incorporated into the criminal justice system. OHA invited Delbert, as with 41 years of experience in the prison system, to come out and participate. And to see Delbert, who's just a lovely, wonderful human being, sitting there talking to the Kamana'apono Crab, who's the executive director of OHA, and Ted Sakai, the director of public safety, and to see this communication going on between former inmate who's still on parole, but surviving, and to see the department and OHA listening and trying to do something, it's just wonderful. And those are things that can only happen if we get these people out. Yeah. And one more thing is, it doesn't just affect the inmate, it affects the whole family. I could just see, people who are estranged from Delbert for years coming forward, and it heals the inmate, it heals the whole inmate's family. It's a no-brainer. Why aren't we doing this? We got to do it.